A lung cancer diagnosis can be devastating. This disease is the leading cause of cancer-related death in both men and women. And while removal of a tumor through traditional surgical means is still the preferred treatment in cases of increased risk, there's now a new option. What's absolutely amazing is that there are no knives, anesthesia, or pain involved in this life-saving procedure.
Who remember what a bond is?
Dolphus Trotter loves spending his days with his students. As principal of a Fresno charter school, he can't imagine doing anything else with his time. As far as he's concerned, a diagnosis of lung cancer was not going to take that away from him.
I've learned to live more in the present, and I've learned to appreciate every moment. I don't have time for things that are negative.
Trotter had surgery to remove a tumor, but when cancer came back, doctors were concerned he would lose lung capacity if they operated. So they turned to the CyberKnife Center, located exclusively at Community Regional Medical Center.
Something like outer space in terms of technology. It was probably the easiest treatment you could go through for the seriousness of the condition I had.
Here's the cancer before treatment. 2 months later, the tumor is already gone. In the same time it would have taken the patient to finish regular radiation treatment, the tumor is already gone.
Dr. Douglas Wong, radiation oncologist for CyberKnife Services, is very excited about the future use of CyberKnife for lung cancer patients. He says the formal clinical trial this facility and a handful of other centers across the country are taking part in could open the doors to a much better treatment option for these patients.
This is going to make a big difference. In our early experiences, even in our operations, we have been able to reproduce what other centers have been describing all along. Very rapid responses, eradication of tumors, and with that, I think, will come higher cure rates. Dr. Brandt is a neurosurgeon, but he's going to do surgery on this patient using this instead of a scalpel.
Instead of 6 to 7 weeks of standard radiation, it takes just 3 to 5 CyberKnife sessions over 3 to 7 days.
And they walk out with no symptoms, and they're done. Go shopping, go on trips. For me, what's a constant fascination is to do the equivalent of brain surgery or thoracic surgery or abdominal surgery or pelvic surgery and have the patients literally walk out of the room, get in their cars and drive off. And the patients are amazed too. They say, is that it? The conventional way of approaching this is you use a big radiation field coming from the front, and then you give another big radiation field from the back. And you have to make it big because the tumor moves. But in the process, you end up scarring down all the lung from hither to yon.
CyberKnife targets only the tumor, not the surrounding tissue. That's why the treatments are shorter. Multiple beams of radiation, more than previously possible, converge at the tumor to destroy it. With the help of tiny gold seeds implanted around the tumor, CyberKnife can follow any motion the patient makes. The patient doesn't have to be immobilized and can breathe normally during treatment.
So even if a person is breathing and as the tumor will move and rotate and twist in the patient's chest, the robot will mimic it completely.
I have not had any side effects from the CyberKnife treatment.
This is a 3D reconstruction. This is what you call virtual surgery.
Getting patients like Mr. Trotter back to their lifestyle so quickly without harsh side effects is something that sets CyberKnife apart from traditional radiation. They can deliver radiation at levels that rival taking tumors out with actual surgery without having to cut into the patient.
The precision is what allows us to treat much smaller areas, spare the surrounding tissues, and still stay on target and deliver a much more intense dose over a shorter period of time.
New students.
For the Trotter family, it was comforting to know they didn't have to travel out of town for this level of care.
Nice to know that we had a treatment that very few places in the country had here in Fresno. And it turned out to be a real good thing. Where are we with after-school enrollment?
This educator loves his work and believes in what CyberKnife can do.
It was a Cadillac of treatment.
And he hopes it will enable him to enjoy many more years with these students.
We're counting on it to do that. Bye-bye.
The CyberKnife lung cancer study is open to patients that cannot have traditional lung cancer surgery and are currently diagnosed with stage 1 or limited stage 2 non-small cell lung cancer.